Hi everyone, my name's Ashley. I'm the clinical lead physiotherapist here at Thorpes Physiotherapy. The purpose of this video is just to answer some commonly asked questions by our patients with regards to shockwave therapy. So in this video we're going to be covering the basics of what shockwave is, how it works on the tissues, so physiological effects of shockwave, a little bit about its history, the conditions we currently treat with shockwave and the evidence base for those, and any potential contraindications, i.e. patients that it may not be beneficial for. And of course, the most important questions I think are what to expect as a patient. What does it feel like? What can I expect during, after the treatment? How is it going to benefit me? So shockwave therapy started to be used in around about the mid-1980s in Germany, and it was combined with lithotripsy to treat kidney and gallstones. So the idea of using this device was to break up those stones in a less invasive way than surgical excision, taking them out via surgery. So this machine is radial shockwave therapy. There are two types. There's focused, which was that device used for the kidney and gallstones, and then there's radial. So about 95% of shockwave machines that you'll come across in orthopedic clinics, in musculoskeletal physiotherapy clinics like Thorpes, will be radial shockwave. Now this is a particularly good device for superficial to moderate depth tissues. So we're thinking tendons, ligaments and fascia, which is the connective tissue. Now this device, it's similar in a way to ultrasound. So ultrasound, we have therapeutic ultrasounds, which is used on tendons and ligaments to stimulate repair. And we have diagnostic ultrasound, which I'm sure you've come across, looking at fetal development, looking at organs, looking at tendons and ligaments. The difference being ultrasound delivers an acoustic sound wave. So in other words, ultrasound is usually completely painless and you don't actually feel the delivery of the stimulus to the tissue. With shockwave, on the other hand, you can see this gun-like device. It's powered by an air compressor. That air compressor fires up the machine. Within this canister is a metal pellet that effectively ricochets up and down the canister, and that then dissipates force through this head. So shockwave not only delivers sound waves, acoustic pressure waves, but also mechanical pressure waves. And it's these pressure waves that will give you that sensation during shockwave. So as a patient, what to expect? Shockwave can be a little bit uncomfortable, and there's almost a mild degree of pain during the session, but it should be absolutely tolerable. And your physiotherapist will be guiding you and regularly just questioning and making sure you feel comfortable throughout. So it needs to be uncomfortable, and a lot of the literature and evidence around shockwave shows that the more energy that we can deliver to the tissue, the better. So what does it actually do? The idea of shockwave is that it's a pro-inflammatory device. This means we're trying to actually conjure inflammation to try and stimulate correct healing processes in some of your bodily tissues. So why are we trying to conjure inflammation? So if you have a problem that's more than 6 or 8 weeks old, particularly if it's months or even years old, this can be a stubborn Achilles tendonitis, this can be persistent tennis elbow, this can be a shoulder tendon problem, or it could be plantar fasciitis, which is commonly known, or as a slang term, policeman's heel. And this is pain under the sole or under the heel of the foot. This is painful inflammation of the connective tissue. And all of these conditions are usually overuse conditions. The reason we're trying to stimulate this inflammatory process is we know that these tissues lack blood. So they have limited blood supply to tendons, ligaments and fascia, unlike muscles, which are blood rich and often repair quite quickly. So this treatment is to try and stimulate a cascade of inflammation for the tissues to repair again. One thing to note is the evidence that supports shockwave is pretty promising and continues to build as the years go by, but it should not be used in isolation. So if you're seen by one of the physiotherapists here at Thorpes, you'll be given a rigorous exercise program targeting those tissues. Take an Achilles tendon, for instance, we need to look at progressive graded loading. In other words, strengthening exercises for the tendon and the surrounding muscles that support that tendon alongside shockwave. So that's got the better outcomes, a combined approach. So who is this for? We've kind of covered that mostly already. So chronic tendon pains or chronic tendonitis, chronic ligament sprains. If you've had an ankle roll or a sprained ankle many months ago and it's not healed that well, if there's callus in the tissue, this may be an application that we can consider. And I say plantar fasciitis is another common area. But there are many areas around the body that may be appropriate with shockwave therapy. But it's particularly for those people, as I say, that have a chronic issue that's persistent, where perhaps conservative management has not really made much improvement. So that could be physiotherapy, exercises, anti-inflammatories, supports or splints, relative rest, and rehab exercises, and you've just found that things are not getting better, then this is a device to then continue. Even some patients who have had corticosteroid injections often then find benefit from shockwave therapy. There are a cohort of patients where this might not be appropriate, and that might be if you've got, for example, very delicate skin, broken skin, active infections around the area, active malignancy, so any kind of cancer or active cancer processes. If you've had long-term steroid use and your skin is particularly delicate, it may be something we need to consider before providing this treatment. So if you'd like to find out more whether shockwave can be beneficial for you, if you contact the clinic on 01276 376 70, give our admin team a call. They can then organise a free consultation, a telephone consultation, to discuss your problem with a physiotherapist over the phone, just to make sure that this is right for you. So I hope that's been helpful. As always, consider following us on Facebook and also our website, where I'll be doing more of these FAQ videos to give you more information about the services we provide. Thanks for watching.